Which part of the human brain is primarily responsible for the coordination of voluntary movements, posture, and balance? Cerebellum. The specialized neurological cells responsible for producing the myelin sheath around axons, specifically within the central nervous system, are oligodendrocytes. Which protective meningeal layer is the outermost, toughest, and most fibrous covering of the brain and spinal cord? Dura mater. Cerebrospinal fluid (CSF) fills the ventricles of the brain and the central canal of the spinal cord. Which specialized structure is primarily responsible for producing CSF? Choroid plexus. A patient experiences an injury to the hypothalamus region of the brain. Which of the following physiological processes is most likely to be disrupted? Regulation of body temperature and fluid balance. What major thick band of nerve fibers serves as the primary bridge connecting the left and right cerebral hemispheres? Corpus callosum. Which lobe of the cerebral cortex houses the primary visual cortex and is responsible for processing visual information? Occipital lobe. The primary respiratory and cardiovascular reflex centers that control automatic functions like heartbeat and breathing are located in the medulla oblongata. A nurse is caring for a client who was admitted with a traumatic brain injury. The nurse notes that the client's blood pressure has increased from 122/70 to 158/60. The heart rate has dropped from 74 to 48 beats per minute, and respirations are irregular. Which action should the nurse take first? Elevate the head of the bed to 30 degrees and notify the healthcare provider. A client with a suspected ischemic stroke is brought to the emergency department. Before activating the stroke protocol or administering prescribed tissue plasminogen activator (TPA), which diagnostic test must the nurse ensure is completed as the absolute priority? Non-contrast computed tomography (CT scan) of the head. The nurse is performing a neurological assessment on a client with a history of balance issues. The nurse instructs the client to stand with feet together, arms at the sides, and eyes closed. The client immediately begins to lose balance and sway heavily. How should the nurse document this finding? Positive Romberg test. A nurse witnesses a client with a history of epilepsy begin to experience a generalized tonic-clonic seizure in bed. Which of the following nursing actions is appropriate? Turn the client onto their side and clear the immediate area of sharp objects. A client who suffered a spinal cord injury at the T4 level reports a sudden severe pounding headache. The nurse notes the client is profusely sweating above the level of injury and their blood pressure is 190/102. What should be the nurse's immediate action? Check the client's urinary catheter for kinks or a distended bladder. A nurse is assessing a client who has just undergone a lumbar puncture. The client reports a severe headache that worsens when sitting up but resolves completely when lying flat. Which intervention should the nurse anticipate implementing? Encouraging increased oral fluid intake and maintaining flat bed rest. The nurse is evaluating a client diagnosed with Parkinson's disease. While planning mealtime interventions, the nurse notes the client has severe bradykinesia and frequent drooling. Which nursing diagnosis takes highest priority for this client? Risk for aspiration related to impaired swallowing mechanics. A client with a spinal cord injury at C5 is being evaluated by the nurse. Which clinical finding requires immediate intervention? Use of accessory muscles for respiration. The nurse is assessing a client admitted with suspected bacterial meningitis. Which clinical manifestation should the nurse expect to find? Severe headache, knuckle rigidity, and photophobia. A client is prescribed phenytoin for the management of generalized tonic-clonic seizures. Which adverse effect should the nurse include in the client's discharge teaching? Gingival hyperplasia. The nurse is caring for a client with myasthenia gravis who is experiencing a significant worsening of muscle weakness and respiratory distress. Which medication should the nurse anticipate administering to differentiate between a myasthenic crisis and a cholinergic crisis? Adrophonium. A nurse evaluates a client using the Glasgow Coma Scale (GCS). The client opens their eyes only in response to a painful stimulus, makes incomprehensible sounds and withdraws from the painful stimulus. What GCS score should the nurse document? 9. A client with a history of aneurysmal subarachnoid hemorrhage complains of a sudden severe headache described as the worst headache of my life, accompanied by vomiting. Which action should the nurse take first? Notify the healthcare provider immediately. The nurse is caring for a client with Guillain-Barré syndrome. Which assessment finding is most critical for the nurse to monitor frequently? Vital capacity and respiratory rate. A client with an intracranial pressure (ICP) monitoring device has an ICP reading of 24 mmHg. Which of the following nursing interventions is appropriate to help decrease the pressure? Maintain the client's head in a neutral midline position. The nurse administers intravenous mannitol to a client with increased intracranial pressure followed a head injury. Which therapeutic outcome indicates the medication is effective? Increased urinary output. A client with multiple sclerosis is experiencing severe muscle spasticity that interferes with diet and activities of daily living. Which medication should the nurse expect the healthcare provider to prescribe? Baclofen. A nurse is assessing a client with a history of complex partial seizures. Which statement by the client indicates the presence of an aura? I smell a strong odor of burning rubber right before I lose awareness. The nurse is caring for a client with a high-level spinal cord injury who is at a risk for orthostatic hypotension. Which intervention should the nurse implement before mobilizing the client? Apply abdominal binders and anti-embolism stockings as prescribed. A client with a head injury develops diabetes insipidus (DI) due to pressure on the posterior pituitary gland. Which clinical manifestation should the nurse expect to observe? Excessive thirst and large amounts of dilute urine. The nurse is preparing to care for a client with trigeminal neuralgia. Which nurse intervention should be included in the client's plan of care to prevent a pain episode? Wash the client's face with lukewarm water and avoid brushing teeth too vigorously. A client is admitted to the progressive care unit with the diagnosis of encephalitis. Which assessment finding represents the most critical complication for the nurse to monitor? Altered mental status and increased intracranial pressure. The nurse is teaching a client who has a new prescription for carbamazepine for seizure control. Which instruction is a priority for safety? Report any fever, sore throat, or unusual bruising to the provider immediately. A nurse is conducting a neurological assessment on a client who is post-op following a carotid endarterectomy. The nurse asks the client to stick out their tongue and notes it deviates to the right side. This indicates damage to which cranial nerve? Cranial nerve 12, hypoglossal. The nurse is monitoring a client with a brain tumor who is receiving high dose dexamethasone. Which laboratory result requires immediate notification to the healthcare provider? Blood glucose of 280 mg per dl. A client with a T2 spinal cord injury tells the nurse, "I have no control over my bowels anymore and I feel so hopeless." Which nursing response is the most therapeutic? It sounds like you're feeling overwhelmed by these changes. Let's talk about a bowel training program. The nurse is preparing a client for an electroencephalogram EEG to investigate a seizure disorder. Which pre-procedure instruction should the nurse give to the client? Wash your hair thoroughly the night before and do not apply hair sprays or oils. A client with a severe head injury is suspected of having a cerebrospinal fluid CSF leak from the nose. Which method should the nurse use to confirm if the drainage is CSF? Check the drainage on a sterile gauze for a halo or ring sign. The nurse is assessing a client who has a history of a brainstem stroke. The nurse notes that the client has difficulty swallowing and an absent gag reflex. Which cranial nerves are most likely affected? Cranial nerve 9, glossopharyngeal, and cranial nerve 10, vagus. A nurse is caring for a client with a temporary ventriculostomy, external ventricular drain in place for increased intracranial pressure. Which action is essential for the nurse to perform to ensure an accurate pressure reading? Align the pressure transducer level with the client's external auditory meatus. A client with Parkinson's disease is experiencing severe freezing of gait, making it difficult to step forward. Which instruction should the nurse provide to help the client resume walking? Tell the client to imagine stepping over an invisible line or object on the floor. The nurse is caring for a client with a T6 spinal cord injury who is experiencing automatic dysreflexia. After elevating the head of the bed to 45 degrees, which action should the nurse take next? Assess the client's blood pressure and check for bladder distension. A nurse is caring for a client with Bell's palsy affecting the right side of the face. Which intervention is a priority to include in the client's home care teaching plan? Apply an eye patch and use artificial tears on the right eye to prevent corneal abrasions. A client is admitted with an exacerbation of multiple sclerosis (MS) and is prescribed a course of high-dose intravenous methylprednisolone. The nurse should monitor the client for which primary complication of short-term corticosteroid therapy. Increased risk of infection and elevated blood glucose levels. The nurse is reviewing the plan of care for a patient with Creutzfeldt-Jakob disease (CJD). Which transmission-based precaution must the nurse ensure is followed for standard care interventions? Standard precautions using specific protocols for handling brain tissues (CSF). A nurse is assessing a client using the Glasgow Coma Scale and notes the client localizes to a painful stimulus, uses inappropriate words, and opens eyes spontaneously. What total score should the nurse calculate? 12. A client with a lumbar disc herniation is scheduled for a conservative management plan. Which positioning instruction should the nurse give the client to reduce pressure on the nerve roots while resting in bed? Lie on the side with knees and hips flexed, placing a pillow between the legs. Which structure acts as the primary relay station for sensory information, gating and sorting paths before sending signals up to the cerebral cortex? Thalamus. A lumbar puncture is safely performed by inserting a needle into the subarachnoid space below the termination of the spinal cord. In adults, the spinal cord typically tapers off at which vertebral level? L1 to L2. Which specific space contains circulating cerebrospinal fluid (CSF) and lies immediately between the arachnoid matter and the inner pia mater? Subarachnoid space. Damaged Broca's area in the dominant cerebral hemisphere results in a specific type of aphasia. A nurse expects a patient with this condition to exhibit which impairment? Difficulty producing spoken words or fluent speech. Thank you.